Steve Simonin. I'm the CEO of Iowa Specialty Hospital in Wright County. We have a couple hospitals, one in Belmont, one in Clarion, and then we have several clinics around in Clear Lake, Hampton, Webster City, Fort Dodge, and now our new one is in Des Moines. We're going to start up a new program called vertical sleeve gastrectomy, and that will be starting next Monday officially. I am the first patient for that service in the Belmont facility. We've been kind of playing around with starting the service up for the last couple of years, and after a lot of consideration and looking at specifically this procedure versus the other procedures, I found that this procedure has better success and a lot less of the complications that the other types of bariatric surgeries have. So, a vertical sleeve gastrectomy is a bariatric procedure where they go in and they extract a large portion of the stomach that contains the hormones that cause hunger. So what happens after this surgery is you're not hungry anymore. Essentially what they do when they take the stomach and they make it into almost like a sleeve or a banana, and you don't have the absorption issues of vitamins, you don't have some of the choking things that happen possibly with lap band. In a gastric bypass, your stomach is a little pouch the size of a walnut. With lap band, there's a constriction of an external band that goes around the stomach. With this one, it's just kind of a smooth, elegant banana or sleeve. This surgery takes approximately 45 minutes, and I expect that I'll probably be out the next day. For years I've struggled with weight issues, and I was kind of the fat kid in grade school, and just struggled with it my entire life, and I want to get back into running. I want to get from a vanity perspective, I'll be able to fit into 90% of my clothes that I can't fit into now. I'll have a smaller appetite. I won't be able to eat normally probably for the first couple of months, but positive nature of what's going to happen very soon has to outweigh those. I would challenge a lot of people to kind of step in our shoes for a moment and see what people with large appetites or who have weight issues have struggled with their entire life. The other thing with me is this is my year where I'm going to turn 50, and I want this to be my midpoint in my life. I don't want this to be my 2/3 point. I don't want to die at 75, and this will lower my risk of getting diabetes. I'm pre-diabetic right now. It will lower my risk of dying from heart issues. I have high blood pressure, my cholesterol is too high. And although I exercise pretty hard 3 to 5 times a week, what's happening is I'm getting a lot of muscles and the weight's still continuing on. So with my BMI where it's at, it's around 40 right now, it's probably going to be at 45 in 5 years, and on and on. And so what I'm looking at is a slower metabolism as I continue to grow older, and these issues are going to continue to plague me the rest of my life if I don't do something. So it's a pretty drastic step. I realize that. However, I've tried all the other things, and I believe in this surgery, and I believe in taking this step. I've been following a lot of blogs. And one of the blogs, they said, what's the one thing you want to do after you've lost the weight on your vertical sleeve gastrectomy? And someone put pull-ups, and I'm like, yeah, that'd be cool. I remember, even thinking back to the presidential fitness test back in grade school and how horrifying that was as a large kid. There's always been things that have been out of my reach. And it's like pull-ups and being able to get back running. I was a runner there for a long time, and I enjoyed that, and I just missed that. And the thing is, I can still do stuff like that, but at my weight, what's going to go next are my knees, and then my hips, and I'm going to have joint pain, and so you just have to be in that chart. So I think I'm a fairly good candidate, and I've gone through all the tests and things, so I'm fairly excited. So next Monday at Belmont, I'm going under the knife.